So, the title of this session we want to think about is Exploring Systems Approaches to Chronic Disease Prevention. As I've mentioned, of my several hats today, I'm wearing the one as the Director of the Australian Prevention Centre. The Australian Prevention Partnership Centre is one of three NHMR3 funded partnership centres. The others are in cognitive decline and sustainable healthcare. Our interests are looking at more broadly about the notion of prevention and prevention systems beyond focusing on individual areas, individual content node areas. We acknowledge that there are fantastic efforts, fantastic work going on in Australia, and there really is. We should be very proud of what's happening in Australia in the prevention space. But we believe that conceptually we have to think differently and move forward in the way that we think about prevention more generally. As I say, the partnership centres, they are jointly funded by the NHMRC and our partner organisations who you can see there. And we sit hosted by the Sachs Institute, but there are more than 20 institutions involved with the Prevention Centre around Australia, more than 40 plus investigators and different groups. And we have spread our tentacles as far as people will let us spread them to draw on that incredible expertise and experience there is around Australia. Today we're going to talk about why we think this systems approach is important and how these systems approaches can be applied in practice. There are other people around who are doing really good work in the space. Hopefully some of them have joined us today and will contribute their thoughts as well as ours to this area. We'll talk about the frameworks, the methods or tools that are described in this and what the benefits and challenges of taking this approach are. Very briefly, you all know the problems, the seriousness of chronic disease and the complexity that trying to do something about chronic disease involves. We all recognise that it involves multiple agents, interacting with each other. That simplistic notion that it's just about individual choices is clearly something which is a very, very limited framework, and one that while it has served us well in some aspects, if we're ever to get on top of this epidemic, we have to think broader than that. We're convinced, and I hope you're convinced, that there is an enormous benefits to be had from preventing chronic disease. We can talk about it in terms of disability and mortality. We can talk about it in terms of the costs and consequences for our population. We believe that there are lots and lots of things that we can do and lots of things that we should try on a scale large enough to be able to show that they either do or don't work if we're going to move ahead in this space. As I've already sort of flagged to you, when we talk about this, we're talking about chronic disease and its determinants and the way we think about it as being multi-layered, as being essentially involving a whole range of different aspects that we need to consider. When we think traditionally about systems, about problems, we tend, partly because a lot of us come from health backgrounds where we tend to think linear and think rationally, we tend to think about breaking things down into pieces, breaking them down into little parts, and then trying to deal with those little parts. And we forget that those parts all form part of a larger entity, and it's the larger entity that we're concerned with. And so people have started to think about what this means, and I'm sure you've all seen maps like this, system maps, where people have started to try and pull together and flag all the different elements that go into thinking about, well, if we want to achieve this, what are the things which are going to impact? How are they going to impact? And when we start to think about that, we sometimes come up with some very interesting different thoughts about and different ways of doing things. So systems approaches, they're a perspective or a way of seeing the world. We try and see it in terms of all of those different components. We're trying to see it in its entirety, and to see it as a set of interconnected elements and relationships that involve complex feedback arrangements as well as the sort of traditional causal pathways. We try to recognise and better understand and harness that complexity to intervene in ways that are more effective, equitable and sustainable. And I think, and when I'm asked about this at a personal level, why are you interested in this? Isn't this something that that is just what public health people do? And the answer is actually, yes, it is. This is what I think I've always done, but I've never actually had a framework, a way of thinking about it that I could convert into a way that I could systematically apply. And for me, the exciting difference of thinking about this way is not because it's got new ideas that, about it, but it gives me a way that I can, when I come to a problem, I can think systematically and apply it. And coming with that, there's a set of tools, methods and frameworks that we're just starting to get a handle on and adopt and apply in relation to that. And hopefully you'll get a better sense of that at the end of today's session. Just briefly, because we have many guests and welcome to Australia, because the case examples I'm going to use here are largely Australian-based, although they all could all be applied in many other settings. I just briefly remind our international audience that we have 3 levels of government in Australia: a national government that's supposed to set national health policy. It subsidises most of the health services provided by the state and territory governments and the private sector. It leads, as the national government, it's supposed to set national health policy. It sets a lot of legislative frameworks for regulation, for example, of drugs and foods and things like that. The state and territory governments deliver health services, including most of the acute and psychiatric services. They provide community and public health services, and they're the regulatory and monitoring arm of government. Also important from a prevention point of view is that they're the level of government which is very heavy in planning, so planning of population growth in city growth and things like that. And then we have local government levels, again, an area that we tend to sort of forget a bit, but they provide important environmental controls, for example, garbage and clean water and health inspectors. And in many places, and it's interesting, one of the things that we've been doing as part of the TAPS is looking at the variation around Australia in terms of how people use these different entities, and this is one of the areas where we're finding some really fascinating differences in terms of what happens between states.